Diverse kinds of ailments bedevil the lives of women across the globe. And if care is not taken, these diseases seem to be on an unstoppable mission to cut short the lives of many in their prime. Such illnesses include, but not limited to, reproductive health issues, sexually transmitted diseases, different kinds of cancer, such as breast cancer, cervical cancer, ovarian cancer. And yet, that's not all. There are more ailments that women suffer from. They also include endometriosis, menstrual issues, amenorrhea, fertility issues, maternal issues, menopause. Hell, the list is endless. So since the globe is still in the celebration mood of the woman, Talking Health also deemed it fit this time to beam light on women's health. So today, we're on a journey to understanding this specific health concern known as fibroid, which affects millions of women across the globe. On that note, I say thanks for joining me on Talking Health, your go-to program on health matters. I am Bumi Idowu.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only. I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Thanks for staying tuned, and if you're just joining us, welcome to Talking Health with Bumi. Today, we're examining the topic fibroid. According to the National Health Service, NHS, fibroids are non-cancerous growths that developed in or around the uterus or the womb. These growths are made up of muscles and fibrous tissues and vary in sizes. They are sometimes known as uterine myoma. But I'm not the one to do justice to the subject matter, since that's not my forte. I have a professional joining me to help address some of our concerns. To that end, I introduce Dr. Kayode Samuel Adebayo, who will help us bridge the missing link. Dr. Adebayo is an obstetrician and gynecologist at the General Hospital Ijayi, and also the medical director at Dayspring Hospital here in Lagos. Welcome, doctor. Thanks for joining me.
Thank you, madam. Good afternoon.
Good afternoon to you, doctor. So let's go straight into it. Doctor, please tell us. We've been hearing it. I've been hearing it a lot. Educators, what really are fibroids and how do they develop in our bodies?
Thank you very much. Well, fibroid is a non-cancerous growth on women's womb, what we call the uterus. And it occurs during the women reproductive age. While I use the word women reproductive age, is that a woman that is born today has a uterus. And a 90-year-old woman also have a uterus. But when you are looking at the prevalence of fibroid, it occurs during the time a woman has attained the age of puberty, at the age of maturity, and all through the reproductive period. It's common among the blacks women than whites. It has something to do with the genetics among the blacks. And it's something that is very, very common. When I want to explain why fibroid growth in the uterus in a simple way to women, especially when we do all these general lectures for women, maybe the market women and all that. I only use one analogy to explain that when the womb of a woman at the reproductive period is like a very fertile land. When you see a very fertile land and you cultivate the land, cultivation means the woman has attained maturity. And years in, year out, you did not grow anything on this fertile ground. When you go back to this land, you see that a lot of weeds are growing there. Exactly happened to the woman's womb. The womb is a very fertile organ. It keeps menstruating every year. And after many years of not growing something in the womb, the tendency to grow fibroid is very high. Wow. What am I trying to say? When you see, there used to be a language by one old gynecologist in the 18th century. He said, good girl gets pregnant. I mean, good girl gets fibroid. Bad girl gets pregnant. What it means is this. When you see a woman, it's a difficult thing I will explain. When you see a woman in her 40s who has never been pregnant before, in most cases, the tendency that she has to have fibroids. In fact, typically you have multiple fibroids there in most cases, except very few. But we see a same woman at the same age of 40 who has aborted about 10, 15 pregnant there. What are we saying? Most times, fibroid is commoner with women who have not been having frequent pregnancies. But it is very common among the blacks. It is not cancerous, but notwithstanding, very, very few, is about 0.01% may in fact, most gynecology may not see one all through their life as a practitioner. So fibroid is a non-cancerous growth that affects women in their reproductive age groups. And because it is a growth that is not supposed to be there, it's associated with a lot of symptoms. It could be associated with a lot of problems. Symptoms like pain. Some of them will say, oh, when I started my menstruation about 15 years ago, I have little pain. As soon as the menses start flowing, the pain subsided. That is primary dysmenorrhea, which is common with most women. You know, say, but about 10, 15 years, about 10 years now, I realized that before the menses, the pain will have started and the pain continues. Or even after the menses, I still keep having pain. By the time you check that woman's womb, you realize that she has a lot of fibroids there that are causing these secondary pains. Some will tell you that, oh, my message is about 3 to 5 days. That is how I've been doing it since I think for about 15, 16 years. The last 3 years now, I realized that the menstrual now flows for more than 7, 10 days. And in between menses at time, I even see some menstrual, some blood flows again. Again, when you check the woman's womb again, you might find out that this problem that is causing this present development in her life, in her menstrual, is some of them, the fibroids could even predispose to, at times, you know, in the woman's, if you look at the woman reproductive system, in the front of it, you have the bladder for the urine. At the back of it, you have the rectum that carry the stool. Some of them, when these fibroids are growing and growing and become so multiple, some of them could have recurrent constipation because the mass that is compressing on the lower part of their intestine, obstructing the normal stool to pass through. Some of them, the fibroid is growing towards the frontal part and is compressing on the bladder. So you start having frequency urinating with the little urine in the bladder, they feel the urge to urinate. All sorts of discomfort comes in when the fibroid has taken over the womb from the woman. Now, why do we now have more fibroids among the women than it used to be when our mothers or grandmothers were? In those days, when you check the history, they get married so early. Most of the time by 17, 18, 19, they are married. Maximum 19, 20, they are married. But these days, you send your girl child to school, You go to the university 4 years program, because of so many issues that comes up, becomes a 6 years program. After school, NYSC, they look for a job. You are now counting another extra 10 years again after school. Most women now, most of our girls child now are getting married in their late 30s and early 40s. By then, majority of them will have developed fibroid. So this is when you delay childbearing. It's one of the reasons why fibroid becomes so common these days than in those schools. If they have to go and learn trade at times, they learn sewing and this, in which are 1 or 2 years, they are done, they have their freedom, they go and marry and they start childbearing. Again, when you see this growth of the fibroid again, also have its own effect on fertility again. You see a woman that just got married a few days ago. I saw a woman, she just got married last year. By the time I checked the uterus is like a 9-month pregnant, a pregnant woman. In fact, she told me that they used to call her Yabiji, even when she was not married. When she got married now, they thought she was pregnant or again. They are saying Yabiji. And when we scan the uterus, there are so many fibroids. I think I was counting about 20-something while I was scanning her. So those are all the things now. And now for the past 1 year now, she's been having difficulty in getting pregnant.
You've already told us, you know, the common symptoms of fibroid. You've told us the causes of fibroids, you know. So I want to ask you, doctor, what are the potential complications associated with untreated fibroids?
All right. Let me put this note down. Most fibroids are asymptomatic.
Can you explain what that means? Many of us don't understand what that means.
Beautiful. When you gather 100 women together, possibly all blacks, and they are all in their reproductive age groups, and you ask them, which of them have all these symptoms of fibroid? Maybe you have at the back of your mind that you want to screen this crowd for fibroid. If you now ask them, how many of you have this excessive menstrual flow, increase in menstrual pain during menses, which was not there before? How many of you see spotting or blood in between your menstrual cycles? How many of you have swelling in your tummy? How many of you have experienced constipation? How many of you have frequency in urinating and all that? By the time you screen these 100 people, you may have up to 60 of them that does not have any symptoms at all. So you put these 60 aside, you now line them up and start scanning them one by one. Yours sincerely, more than half of those 60 will also have fibroid, even though they did not come down with any symptoms. So most fibroids might be asymptomatic. Let's have that at the back of our mind. So most of the time, it's usually an accidental findings when maybe when they come for infertility screening and all that, or they just come for routine pelvic scan. And oh, madam, you start asking questions. How's your menses? I think was it Monday? Yes, Monday when I was scanning a woman. I saw about 6 big fibroids. I said, madam, how many days do you flow? Oh, says sir, my flow is still 3 to 4 days. Do you have any pain? Menstrual pain that is unusual from what you used to have before? She said, no, everything is fine. And I said, but do you know that you have some fibroid? He said, no, I'm not aware. I said, okay, just lie down. I used her hand to touch on. Do you feel something like a ball? He said, yes. He said, one of those days she was lying down, she felt it was the food she just ate. I said, no, it's due to fibroid. So at times it could be asymptomatic. Yeah.
Interesting. So
now, what are the likely complications that can rise from fibroid? That's the question.
From untreated fibroid.
Well, you see, from untreated fibroid, if it is asymptomatic, we don't bother ourselves. We don't get worried about it at all. Okay. But in few cases, when they are asymptomatic, this is now about fertility. They are asymptomatic, but when you scan the woman, you saw so many fibroids there. And the only reason why you are seeing the woman is because, sir, I've married for 4 or 5 years, not getting pregnant. If you check this woman very well, you check the hormones, you check everything, you realize that the hormones are fine. You check the ovarian reserve. The ovarian reserve is beautiful. You know, I'm not just a gynecology, I'm a reproductive specialist here. You check everything and you realize that everything is okay. The only thing you are finding is fibroid. Now, the research and experience in the practice has shown that when you remove fibroid from these women, that every other thing is normal apart from the fibroid, majority of them get pregnant spontaneously.
Wow.
Yeah,
Wow.
those are the things, those are the findings we have. That's why in the new reproductive system now, in vitro fertilization, IVF, when you see multiple products, in most cases, you advise the patient to go and remove the fibroid before coming for the IVF, because that will increase the chance of success of the IVF.
Okay,
So there are a lot to say, there are a lot to discuss about uterine fibroid when it comes to women's health, when it comes to infertility, when it comes to everything about the woman's health.
I also want to ask, and this is on the last note before we wrap up the program today, does genetics play, let me just say, what role does genetics play in the development of fibroid? And are there genetic tests available for identifying susceptibility?
A genetic test to test if a woman will develop fibroid or not.
Yes.
No, nobody is even thinking about things like that. Okay. The only thing we know is that by virtue of blacks, most blacks will develop fibroid. Then another thing you look at is that some women will tell you that, oh, my mom told me too, she has multiple fibroid when she was younger. Some of those are all the way we normally screen when we speak with them. But that there's a specific blood test that a young girl will do to show if she's going to have fibroid or not. No, there is really no time wasting time on such things. So because we know that if we take, for instance, a woman has multiple fibroid, she delivered, she had babies, She was not asking me that, is her daughter going to have fibroids? And I said, for you, yes, because she's worried that, hope the girl has not had fibroids. I said, no, to start with, the girl has not even started menses. So, but the issue is this, you got married at 39. So please train your girl child as early as possible so that she can get married early. You got married at 39, and you told me already that the fibroids started coming up when you were 33, 34. So what if you are married around 30, 31, 32, and you start your child behind? Maybe you will not even develop fibroid, or if you develop, maybe so things that are not going to have any effect at all on you at all.
Thank you so much, Dr. Adebayo, for coming on the show today. We appreciate your time and your input. Thank you so much.
Thank you. Thank you.
A very big thank you for staying tuned to Talking Health today. Until I come your way next time, think health matters. Think Talking Health with Bumi. Bye for now.